First of all, I mean, really the best thing is not to lose your teeth. All right. So, if you are diligent with your regular checkups and seeing a hygiene, then you shouldn't ideally lose any teeth. But if you do lose a tooth, you invariably lose bone and gum around it. You lose the bone volume and you lose gum volume. And even though it may be possible to place an implant, it never really quite looks the same as a tooth unless that volume is restored. At the other extreme, for patients who've lost all of their teeth, they may sometimes not have enough bone for an implant to be placed. There's literally nothing there, maybe a millimetre or two, which simply isn't enough. So we have different ways of reconstructing bone to ensure that implants can be placed. Sometimes we can do it at the same time as an implant is placed and just make up for any deficiencies. At other times, we actually have to reconstruct whole volumes in 3 dimensions and keep a patient functioning throughout that process. So it's not just about doing the bone augmentation, it's how is that patient going to function and look presentable during the healing process, which can take 6 months to a year sometimes. So reconstruction of the bone volume and the gum volume and the quality of gum around dental implants is integral to their long-term success. If you have thin bone, thin tissue, and it's sore to clean and it's a food trap, then even the best implant is going to suffer from inflammation later on, loss of tissue recession, and often loss of the implant as well. So we plan all of that from the beginning. And of course, it means that initially our implant treatment may seem more costlier than somebody else's, but in the long run, you forget about that cost because it's stable and you don't need to worry about it again for the foreseeable future. So really, I think when you come to LCIAD, you come to a centre of knowledge. We've spent all of our lives doing these treatments, spending our lives going around the world, looking at how other people do these treatments, learning from colleagues, exchanging ideas, looking at what's current, looking at what works long-term, tracking the literature. And really, when you come to us, it's a culmination of all that knowledge. And when we recommend something to you, we normally do it in the knowledge that it's going to work well for a long period of time.